Michael is a 23-year-old college student. He was diagnosed with asthma at age 11 years. He has struggled to maintain good control over his asthma symptoms for the last several years. Today, Michael returns to Dr. Yawn's office after he was treated in the emergency department a few weeks ago for an asthma exacerbation.
Hi, Michael. How have you been?
I'm doing okay.
You don't sound very convincing there. I am pleased that you have come in after your last visit to the emergency department. That's very important. But this asthma APGAR tells me that things are really not going all that well. It says that you're missing a lot of activities, you're having symptoms several days a week, and you're waking up at night from your asthma too. I guess that's a real problem. Do you think most of the waking up is from your asthma symptoms?
Well, yeah, that is true. I haven't been feeling that great, coughing more, and more trouble catching my breath walking from class. I haven't been sleeping that great either. I'm waking up several nights a week, needing to take my inhaler. But I am taking my inhaler like you showed me. I took your advice and set a reminder on my cell phone so I don't forget. Your nurse actually watched me take it, and she said I was doing okay, so I'm not really sure what's going on.
I can see that you are doing okay with the inhaler technique, but looking at the asthma APGAR, I can see that you're really having quite a bit of trouble and using your quick relievers, you said. So when I look at the list of medications, I see that last time we did add another medication. We've started with 1, now 2, and we've added the asthma pill because of all your allergies. And that was even before your last visit to the ER. So you're taking combination therapy in your inhaler and the asthma pill, but you're still not doing so well.
Yeah, I am taking the pill every day and the new strong inhaler that you gave me. I finished the antibiotics and prednisone they gave me from the emergency room. I guess I didn't realize how sick I was before I went there. And I just thought with midterms last week, that was what's making me feel so run down. And you know, the last couple times that I took the prednisone, it made me really anxious. And I had a lot of trouble falling asleep, some weird dreams too.
Those are side effects of the prednisone. Some people have more like this than others. But I am glad that you did go to the emergency room. I think that you maybe even waited a little bit too long for that. That's important that you get there. And I'm really glad that you took all of the antibiotic and all of the prednisone pills. Those are really important. They do, as you said, have some side effects. And, you know, we really use them to reduce the inflammation. Now, your inhalers reduce the inflammation, but when it gets really out of hand, that's why we have to use the prednisone to really calm everything down. But, you know, when I look, you've been to the emergency room twice in the last 6 months. That's including this most recent time. And I see that there's some other times you've been when they called it bronchitis instead of calling it an asthma attack. And those probably really were also asthma attacks. So that makes 4 times in the past year. And some of those asthma attacks have been really pretty long durations. So I want to make sure we know what's going on. I see that you did get the spirometry I asked you to. That was done today? Okay, that's good. Let me look here. Oh yeah, okay, I see the results. And they do show that the asthma is actually affecting your lung function. It was down to 70% and then went back up to 90 after you took the inhaler. You may remember we talked a little bit about that. The 70%, that's 70% of what somebody your age and size should have, and we'd like it up around 90. Now, it did get better with the medication, and so that's good.
What does that mean, Doc?
You know, when I look at all of this put together, what it says to me is that I think that you have severe asthma. Now, what I've put together is your visits to the emergency room, the number of times we've had to use oral steroids, that I have you on really pretty high dose inhaled corticosteroids, even this addition of the asthma pill. I know that you're taking your medication. You're very good about doing that. You've set your cell phone, as you said. We've looked at your inhaler technique. That's good. We've checked for the allergens, and you are allergic to a few things, but we have been addressing those. I know that the smoking was an issue. Some of your friends were smoking, but you've made them not smoke in your apartment anymore. Nobody's smoking in your car. So what you put all that together, you're doing all the things that we ask you to do, but still, even with those medications, you're having problems. But what is important is that we recognize that you have severe asthma, and we have something we can do about it. We've done everything I know how to do. I need more help to get you more help for your asthma.
So does that mean I'll need to take even more medication every day?
Well, I don't think it'll be every day. I don't know yet. That's why I really would like you to see my colleague, Dr. C. She's an allergist, an asthma specialist, and she knows a lot more about these newer medications that are now available for severe asthma. Most of those you don't have to take every day. I really need you to see her for her to assess what's going on and make recommendations that both of us can follow. How does that sound to you?
Yeah, I guess it does seem that my asthma has been getting worse, and it's really starting to interfere with my life. It's tough keeping up with schoolwork when I'm sick and feeling lousy. My roommate complains a lot that I'm coughing throughout the night, and my girlfriend, she gets mad at me when I say I'm too tired and don't feel like going out at night.
Yeah, and those are not things we want somebody your age to have to put up with. It sounds like the asthma is really bothering you. Dr. C has been great with several of my other patients and been able to find things that have helped them a lot. I would really like you to see her. Now, it sometimes can take a little bit of time to get in. She's very busy, but I think it's really worth it. In the meantime, you need to keep taking the inhalers, just like you are very faithfully. Take the asthma pill, and let's take a moment to review your asthma action plan, because I would like you to get to the ED a little earlier next time than you did this last time. I'm hoping you never have to go again, but just in case, let's look at this together and see what it says. So we know that